Good afternoon, everyone. Welcome to today's SVS VQI Smoking Cessation webinar series. My name is Jennifer Correa. I'm the marketing manager here at the SVS PSO, and I'm joined today by Betsy Weimer, SVS PSO Director of Quality. Before I turn things over to Betsy, I do just want to cover a few brief housekeeping items. We will be keeping all lines muted throughout today's presentation, but please type any questions you may have in the Zoom Q&A box. For the Smoking Cessation series, we will not be answering questions live during the event. Instead, we will be compiling all questions and answers and creating a frequently asked questions document. This document will be updated following each smoking cessation webinar and posted on the VQI website, along with the recordings and slides from each session. And with that, I'll turn things over to you, Betsy.
Thanks so much, Jen. Welcome, everybody. This is our National Quality Initiative Smoking Cessation Webinar Series number 9. Each month, we always share our disclosure or disclaimer. Our National Quality Initiative Smoking Cessation Webinar Series is based upon my knowledge from taking and passing the CTTS certification course in 2024. As a reminder, each state, province, and continent is unique and offers their own individualized smoking cessation resource. Insurance reimbursements also vary state to state as well as internationally. This National Quality Initiative Smoking Cessation webinar series is intended to provide a variety of resources and knowledge for VQI participants, but not replace expert opinion or treatment for individual patients. Our webinar series are monthly webinars. There's also recordings, slides, various resources, and as Jen shared, a monthly FAQ document. All of these can be found on a dedicated area on our VQI website, and the hyperlink is at the bottom of the screen. Here are our 12 monthly date, topic, and audience. Here are the topics expanded. We've already covered these. And today, we're going to start with our evidence-based professional resources. We're only going to do the first half. As you can see, there's several of those that I'd like to cover, and then we'll wrap these up next month in October. So let's get started. We're going to start with a quick fact. Experience shows that evidence-based practice, or EBP, benefits healthcare systems by producing better patient outcomes and reducing cost. And this is actually true. Evidence-based practice has been shown to be effective within the following ways. It leads to the highest quality care and patient outcomes. It reduces healthcare cost. It reduces variability in care. It increases healthcare provider empowerment and role satisfaction. It reduces healthcare provider turnover rates. It increases reimbursement. It reduces complications and payment denials. And it meets the expectation of an informed public. Here's our evidence-based practice pyramid. And as you can see, evidence-based practice is right in the center. And it's touched by clinical expertise, patient values and preferences, and also the best research evidence. Evidence-based medicine is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. The practice of evidence-based medicine means integrating individual clinical expertise with the best available external clinical evidence from systematic research. The fundamentals. In 2008, the fundamental tenets of evidence-based medicine, two bullet points I want to highlight. These were developed, and there was an evidence hierarchy, which was a guide in clinical decision-making. And evidence on its own is never sufficient to make a clinical decision. In 2015, the fundamental tenets of evidence-based medicine, a couple of bullet points I wanted to highlight here. The awareness of best available evidence required for best decision-making. Evidence-based medicine helps us understand how trustworthy evidence is. And when once again, the same bullet point, Evidence on its own is never sufficient to make a clinical decision. So, as you can see, the fundamentals of evidence-based medicine, two important or one important point to make is in 2008 and 2015, the one bullet point did not change. Evidence, again, on its own is never sufficient to make a clinical decision. So I want you to remember that as we go through all of these evidence-based practice. So we do have an evidence hierarchy pyramid, and you can see the higher the pyramid, the better the quality of the evidence. So you start with systematic reviews, then you go down to critically appraised synopsis or synthesis, then you have randomized control trials, you have cohort or case-controlled studies and guidelines, case reports and series, review articles, and then background information and textbooks. At the very top of that pyramid, there were systematic reviews, and you can kind of see this little guideline here. So the steps in a systematic review include identifying a question, creating a protocol, defining inclusion-exclusion criteria, systematic literature search, selecting studies for inclusion, extracting the data, assessing the quality of evidence, evaluating the risk of bias, and synthesizing the results. This all leads to patient clinical practice guidelines, and the use of these guidelines make better informed shared decisions. Now, I'm not going to go into that entire pyramid, but I did just want to kind of go back into the various steps. Let me go back one. The various steps of the evidence hierarchy pyramid, just to kind of share what truly goes into evidence-based. So what does evidence-based mean to patients? So clinicians understand what evidence-based practice means, but it is our role to inform patients what evidence-based practice is. And it's not just about what the return on investment is. So it's quality patient care. It's patient safety. It's improved patient outcomes. It's improved patient quit rates. It's informing the patient, the public, and our communities with evidence-based, proven information. It guides us to make better informed decisions. It helps the patients make better informed decisions regarding their health care. It also helps their loved ones make better informed decisions regarding health care. It also helps in informing and improving insurance reimbursements. So again, clinicians understand what evidence-based practice means. But again, as our role as healthcare workers, it is also our responsibility to pass along our knowledge and expertise to the public, our communities, and our patients. So now we're going to go ahead and get into and start with our list, first half of our list of some evidence-based practice resources. And then again, as I shared, we're going to wrap all of this up in October. So the first one is the ATUD, or the Association for the Treatment of Tobacco Use and Dependence. So this is actually an organization of nicotine tobacco treatment specialists and researchers that are dedicated to the promotion of and increased access to evidence-based tobacco treatment for the tobacco user. ATUD has an international reach with members in the US, Canada, the UK, and nearly 24 other countries. If you're seeking help to quit smoking, you can find a list of resources, organizations, and credentialed counselors who provide nicotine and tobacco cessation treatment. This is also where you can find a list of the CTTS, or the certification that I took in 2024, and how to get started and obtain your own certification. There's also a listserv that you can join on this website to the network so you can stay connected with other CTTS trained individuals. So again, this is ATUD. Next, a lot of us are very familiar with the CDC, or Centers for Disease Control or Prevention. So they have a ton of resources for quitting. And a lot of people are very familiar with the 1-800-QUIT-NOW. and they have various languages that this is also available in. There's text messaging services, smartphone apps, and they also have several social media resources. And several of you are very familiar with the television ads. Here's one example of that, the tips from former smokers, the Cessation tips ad. In addition, they have managing common withdrawal symptoms, quit smoking medicines, tips for quitting, various quit lines, specific state quit line services, and also making a quit plan just for specific to that individual as well. In addition, you have smokefree.gov. This is another excellent evidence-based resources. They have smokefree.gov. They also have a smoke-free for veterans. They also have smoke-free for teenagers as well. And again, you can see the tools and tips here. I want to quit, my quit day, I recently quit, staying quit. They have apps, social media, resources on NRTs, also texting programs, building a quit plan, and just a plethora of resources. Becoming an ex-smoker. You'll also see that this also has the Truth Initiative here. We're going to get into the Truth Initiative in October as well. But Becoming an Ex-Smoker is an organization that was actually in conjunction with the Mayo Clinic as well. Again, this is also in conjunction with the Truth Initiative, which we will get to in October. It's an excellent program, but it's developed again in conjunction with the Mayo Clinic, and it's freedom from nicotine addiction. And it has excellent physician experts that developed this evidence-based resource for quit smoking. You also have the National Quit Line. And in addition to this 1-800-QUIT NOW, it's also used internationally as well. So again, the National Quit Line is 1-800-784-8669 or 1-800-QUIT NOW. And again, if you or a loved one or your patients are thinking about quitting and would like some help, a quit line may just be what you need to succeed. They provide free coaching, and again, it's just directly over the phone. It's a confidential line, and they have a highly trained, dedicated coaching for smoking cessation. Kill the Can. So the mission of Kill the Can is as follows. So this site and community are designed to help people quit using smokeless tobacco. This includes all brands and types of chew, dip, snuff, and spit tobacco. They are there to make the incredible difficult journey attainable. They understand how difficult it is and how difficult it will be, because like several people they are addicts. They're not former addicts. They say that they will always be addicts who no longer chew tobacco. So they provide a forum where questions are answered, your fears are dispelled, and your anxiety are dissipated. They do offer any help that they can, and they will help you quit the way that you need to quit. They say that they also realize that there are a variety of ways that will be successful in quitting chewing. They will not tell you what way is better than another, but they will tell you about their experience and what has worked for them. They will tell you when you are doing something counterproductive to quitting, and they want to remind everyone that their quit is for you and about you. They are simply there to aid you along your journey. If you need tough love, they will give you that. And if you need encouragement, they will also give you that. Their claim is also if you need to be scared into quitting, they will do that as well. And using this photo right here, that should be enough to scare anyone. Although this website is dedicated to quitting smokeless tobacco, we understand Their addiction centers around nicotine. Therefore, the smoking of cigarettes, cigars, or pipes, or even using snus is not acceptable to this dedicated Kill the Can during your smokeless tobacco quit. And they recognize that people need to be on this journey their own way, and they realize that together we will all be more successful. So that is Kill the Can. So various state resources. So during my CTTS certification course, we actually studied West Virginia. So this is just basically a reminder to know your state and the resources that are available. So again, here, this is just an example. This is westvirginia.gov, and you can see here that they have their own division of tobacco prevention. So they have programs in cessation, they have something for youth, and in West Virginia, they have something called Catch My Breath, and I'm actually going to share that in just a few moments. In addition, they have Quit Vaping and 1-800-QUIT-NOW, and also Treat Yourself to Health. So again, just make sure that you check out and see what exactly is in your specific state. End the trend. So in the Trend website, this is another evidence-based resource. It actually shares the following information. This is also for educating teens, preteens, and parents. They understand that smoking cigarettes is harmful to your health. It's part of the reason why fewer and fewer adolescents are doing it, but vaping has taken a strong hold in youth culture despite a meaningful decline in usage prevalence in the past several years. Get up to speed on the trend and insider info for teens to separate fact from fiction. Then use everything from videos and posters to stickers and memes to build your own campaign, spreading the word at your school and throughout your community about why it's time to end the trend. So again, they have something specific for teens, for parents, and also those that have already quit. So again, this is for e-cigarettes, vaping. Now, as I just shared with you, something about Catch My Breath. This is an evidence-based youth vaping prevention program. This is used in West Virginia, but for others as well, and it has been proven effective. So this is a peer-leading teaching approach that empowers students with the knowledge and skills needed to make informed decisions about e-cigarettes and resist social pressures to vape. Informed by tobacco youth prevention researchers and practitioners, years of real-world implementation, and a youth advisory board, it is the only school-based vaping prevention program proven to reduce the likelihood of vaping among youth. And finally, our last one for today is Aspire. Aspire is a smoking prevention interactive experience. It's a free online prevention from the University of Texas MD Anderson Cancer Center. It delivers tobacco prevention education to teens and adolescents, again, at a self-directed pace. Aspire was actually created over 20 years ago, and the program has been revised and updated. I think the version is 2.0 in January of 2018. This update was generously supported by the Hildebrand Foundation. And then since 2018, over 150,000 students from over 800 schools and organizations in 47 states have actually enrolled in this program. Aspire is not an intervention program for cessationist quitting, but the program focuses on changing attitudes and perceptions. It is not a behavioral change program, though. I do want to point that out. So we'll move into our questions for today. So based on that hierarchy of evidence pyramid, so that pyramid that we discussed, select the highest level of evidence from the types of research studies listed: cohort studies, single randomized controlled trial, case-controlled studies, systematic reviews. And it's a systematic review, and that's the one that we actually discussed today. We'll go into more of these next month. So question 2, again, referring back to that hierarchy evidence pyramid, select the highest level of evidence from the types of research studies listed. Again, cohort studies, single randomized controlled trial, case-controlled studies, and expert opinion. And it's a single randomized controlled trial would be next highest based upon these four answers. Question 3. To remain current with tobacco dependence treatment, it is important to apply tobacco treatment information attained from evidence-based research articles containing education courses and through communication with other professionals who treat tobacco dependence. And that's true. Question 4. Select the goals of the Association for the Treatment of Tobacco Use and Dependence, which is also known as ATUD. 1. Evaluate training programs' compliance with established standards. 2. Recognize training programs which demonstrate compliance. 3. Serve as a resource for Tobacco Treatment Specialist Certification, CTTS. 4. Establish and continually review CTTS training standards. Or 5. All of the above. And it's all of the above. Question 5. Catch My Breath is the only school-based vaping prevention program proven to reduce the likelihood of vaping among youth. And that's true. Question 6. Kill the Can is a website dedicated to quitting smokeless tobacco. Therefore, the smoking of cigarettes, cigars, or pipes or using snus is acceptable to them using the Smokeless Tobacco Quit Journey. That's false, because it is not acceptable to them used during the Smokeless Tobacco Quit Journey. Here are your resources. I actually have 2 pages of those. And then finally, if you have any questions about today's webinar or suggestions, please email those directly to me. And again, at the end of this webinar, we will develop a list of frequently asked questions, and we will provide those with the recording and the slides directly on our VQI website at the hyperlink down below. Thank you again for being with us today, and we hope you have a lovely day, and we'll see you in October to wrap up all of our evidence-based practice resources for smoking cessation. Have a great day.